Hello, I'm Elizabeth Moore. I'm the President-elect of the Royal Australian and New Zealand College of Psychiatrists and taking on the role of President at the end of May. I'm a psychiatrist and I've been a psychiatrist for over 33 years and have worked in most of the states and territories in Australia. My special interests are in social and economic determinants, but being one of those older psychiatrists, I've worked in child and adolescent, general adult, older person psychiatry. In fact, most things apart from forensics. The current membership base of the college is about 7,900 members, of which we have over 5,600 qualified psychiatrists. Those consist of both fellows and affiliates of the college. We have about 2,200 members who are training to qualify as psychiatrists. We also have a number of members in 33 other countries worldwide. Part of the role of the college is advocacy. So people are at the heart of psychiatry, and the work of the psychiatrists and the college is about ensuring people have access to high quality help. A key focus for us is reducing stigma and barriers and promoting affordable and equitable access to mental health care and support. So for us, that means engaging with government on building a strong psychiatry workforce to meet community needs, addressing those social and economic determinants, and advocating for early intervention and prevention for every Australian and New Zealander. We also elevate the voices of people with lived experience, and we do have members on several committees, and we advocate for improved mental health outcomes for Māori and Aboriginal and Torres Strait Islander peoples and other key priority groups. We had a number of asks. The biggest ask was there to actually develop bulk billing incentives for psychiatry consultations for patients experiencing financial disadvantage. We believe that affordability is the foundation of a strong mental health system. And there are about 18% of Australians needing to see a psychiatrist that report missing out because of cost. The $3.5 billion investment to triple bulk billing incentives for GPs will be a welcome relief. But for those Australians experiencing financial disadvantage, the cost of seeing a psychiatrist can mean delaying receiving a diagnosis or delaying care. Increasing the bulk billing incentive to 100% is critical for ensuring equitable access to mental health care. No one should have to make difficult decisions between accessing care and other basic necessities. Older people, we have an ageing demographic, and what we have asked is to increase access to medical care for older people through better availability of funded expertise from old age psychiatrists. So the 65 and over population is expected to more than double between now and 2057. And it's expected that the number of older Australians with mental illness will grow accordingly. And there's a similar percentage in New Zealand. At present, aged care services don't meet the mental health needs of older Australians, and we do need to have an investment in the older age workforce, especially in psychiatry, to deliver care for older Australians. Specialist psychiatrists, psychogeriatrician, MBS night numbers for assessment, providing support following diagnosis, and management of those with dementia and neurocognitive disorders and their behavioural and psychological symptoms is key. We would advocate that they would support follow-up of patients and plan reviews either in person or through telehealth with the care staff. Also, in the new National Framework for Action on Dementia, there needs to be specific targets for the availability of psychiatric expertise and to outline those specific roles of jurisdictions in the care pathways. We have significant experience in the aged care sector, and dementia was the second leading cause of the total burden of disease and injury in people aged 65 and over. While dementia is a common disorder, the psychiatric complications of dementia do require the involvement of psychiatrists as experts in care, treatment and management. We have some welcome things in the budget. So we welcome the fact that there was 260.2 million over 2 years to extend the Commonwealth psychosocial supports for people with severe mental illness who aren't in the NDIS. We welcome the 0.9 million over 2 years to develop the 10-year National Action Plan to support the health and well-being of the LGBTIQA+ community. And also the 40 million over 4 years to establish the National Clinical Quality Register program for tracking the safety and performance of treatments and devices and improving the ability to have performance reporting for clinicians and for hospitals. I think it's also worth noting the 4.9 billion over 5 years to increase support for people receiving working age payments, including the job seeker payment. In the college submission into the Senate inquiry into poverty in Australia, we urged for an increase to that allowance rate for Australian accessing government-funded payments, including job seeker. The cost of living pressures is something that also we welcome the attention to. We all know that poverty is actually linked to poorer mental health and health outcomes. So some of the things that we'd still like to see government address are those with serious mental, severe and complex chronic presentations, having extra support through government. There are positive measures for mental health in the budget, but the funding is very much weighted to wellbeing initiatives and to primary care. A particular group of concern to us that we would like to further work with government around is children. About 3 in 4 children with a severe mental health disorder are missing out on critical support. We estimate that of the 80,000 children in Australia with a severe mental health condition, only 22,000 are currently seeing a psychiatrist. And we do need more child and adolescent psychiatrists, and this has been identified as an issue for some years to actually meet the needs of this most vulnerable group. I'm really looking forward to the College Congress this year. So the Congress will be in Perth, and it will be from the 28th of May to the 1st of June. The theme is really around connection. So there is a great deal of evidence around connection and its positive impacts on mental health and on people that have a severe mental illness. We want to look at connection in terms of First Nations people. We also want to have a look at climate health. And once again, the impact that has on both health and mental health, there's a vast body of evidence. We're also going to be looking at the criminal justice system, at the mental health care system and the disability sector, as well as drug and alcohol services. There is a significant comorbidity with mental illness and drug and alcohol. I want to come back to that theme of integration, connectedness, not only for people in the community, but also integration between services to provide that person-centred care. And looking at carers as part of the integral triangle of care. I have in front of me a few of the things that we're going to be discussing apart from that, and that's around rural pathways and making sure that we have access and are able to supply reasonable services to rural and remote areas. One of the things that comes up a lot recently is ADHD, and I'm looking forward to David Coghill's session on that. We know that eating disorders have one of the highest morbidity and mortality rates of any mental disorder, and there will be a really exciting piece around eating disorders. And my particular interest as well in climate change. looking at climate change with Sibel Day and Pat Dudgeon. Fabulous session. As well as, of course, children's mental health with Valsa Epen.